Warm greetings from Sri Lanka. Migration of human capital to resourceful settings is a priority problem in human resources for health in Sri Lanka. Several factors have contributed to dissatisfaction and human resources, especially those with higher skills and qualifications migrating towards more resourceful settings, both overseas and within the country. Some examples include inadequate salaries, inadequate facilities to provide healthcare services and for continuing professional development, inadequate personal benefits, for example, poor prospects for children's education, unsatisfactory work environment, poor general management of human resources, prevalence of a trade union culture, poor collaboration with other organizations such as universities, NGOs in utilizing resources for health development and healthcare delivery are some of the examples. The system also suffers from a lack of a referral system, lack of guidelines and protocols, poor supervision and poor research ethos with resistance to change. The above factors directly and indirectly through complex interactions promote migration of human resources for health. Migration to other countries is most evident among doctors and dental surgeons. Highest human resource losses among specialist doctors emigrating from Sri Lanka between 1997 and 2000, about 28% of the specialists who qualified had left the country. We lack a proper monitoring system to track these migrations. The Sri Lanka Medical Council requires its members to renew their registration once in 5 years. The number of active registrations increased by only 775 per annum, compared with 904 new registrations per annum. This deficit of about 130 doctors per annum, it's about 15% of new registrations, may be attributed to exit of doctors due to overseas migration, retirement from active work, etc. Migration affected Sri Lankan health system as most categories of health personnel were in short supply. But lately, we are happy that we have now 8 medical schools, and annually about 1,000 doctors pass out from these medical schools, in addition to about another 100 returning from training overseas. Currently, the output is adequate to cater to the demands, but there is a shortage in terms of certain specialities. For example, anesthesia, pathology, ophthalmology and psychiatry are some of the specialties which are badly affected due to the migration. In terms of nursing categories, we had a very big deficit till recently. And during the last 3 years, the government embarked on an ambitious program of training 15,000 nurses. And already we have trained during the last 3 years 11,000 nurses, and another 4,000 are undergoing training. With this 15,000, our vacancies will be filled, and we will be having adequate nurses. And we are now, the government is taking initiatives to promote external migration and making avenues for a limited number of nurses to go overseas. In that respect, recently we signed a memorandum of understanding with the state of California in the United States, who are willing to undertake about 1,000 nurses per year. And with regard to, it is hoped that developing attractive working environments and incentive schemes, including continued professional development, would help to retain human resource within the country, improve the equity of distribution, and promote their professional development, thereby helping to deliver better health care to the people in both quality and with equity of access. Sri Lanka welcomes the initiative for a global code of practice on the international recruitment of health personnel. I wish to emphasize the importance of reciprocity or compensation through recipient countries supporting training institutions and effective return migration in source countries. We look forward to the Global Discussion Forum. Wishing the forum all the very best and the success. Thank you very much.
Thank you.